The Australian Dementia Network is a first for our nation. It has a clear mandate to accelerate our understanding and treatment of dementia. Funded by the Australian Government's $200 million Boosting Dementia Research Initiative and supported by two invaluable philanthropic partners, it is a true game changer. 3 smart initiatives are transforming the way we treat people living with mild cognitive impairment and dementia.
We're setting up Australia's first truly national registry for people living with dementia and mild cognitive impairment. For the first time, we'll be collecting information about the quality of care that is being delivered and using that information to drive improvements. We're asking consumers and their support people about their experiences, and we're listening. For the first time, we're collecting evidence that will directly impact the way clinicians and researchers can care for their patients.
We know that a clinical quality dementia registry is going to be hard to implement, but the benefits to the care that patients receive and to their carers will be substantial. So we are determined to succeed for the good of the nation. The Australian Dementia Network is connecting our researchers and clinicians, whether in Sydney or Cairns, to other teams around the world, from Boston to Stockholm, to accelerate progress in dementia research. We're also working to build commercial partnerships, for example with the pharmaceutical industry, so that Australian dementia research can power ahead.
We're excited to be supercharging clinical trials in Australia with 4,000 people who are trial ready. We're inviting people who are at risk, who have mild cognitive impairment or dementia, to be available to work with us as we build 10 trial sites around Australia.
We know that participating in a clinical trial is unlikely to help Ray, but he has done it to give hope to our grandchildren and patients of the future.
It's the right thing to do.
Every person in Australia should have access to the same quality of care when they attend a memory clinic. In ADNET, a whole team of neurologists, geriatricians, psychiatrists, neuropsychologists, and other allied health professionals are working alongside memory clinics to improve access, standards, and support. We're developing national guidelines, accreditation systems, and training programs to ensure our memory clinics are world-class. We will work with government, health departments, and policymakers to reduce waiting times, improve the speed and accuracy of diagnosis, and harmonise assessments nationwide. In a nutshell, we're addressing the research to practice gap to improve healthcare.
The memory clinic has been a wonderful source of support for us. When you're first given this diagnosis, you're in shock and you're quite scared and certainly very sad. But once things settle down, as John's carer, I really needed to link into other services. And the memory clinic was terrific and they helped us to do this enormously.
We also attend a coffee morning where I meet up with the other people in our situation, and it's a real benefit, and particularly the way I feel about it.
So what can you do? Consumers, please tell your doctor if you would like to be on our list for future clinical trials. Clinicians, use the Clinical Quality Registry so together we can get a clear picture of the trajectory of the disease. Researchers, connect with our clinical trials team and help build a network of researchers dedicated to improving our diagnosis, treatment and care of this vulnerable population of Australians. A genuine network is growing, with clinicians, researchers, participants and carers talking, learning and acting to improve diagnosis and care. Thank you for being a member of the Australian Dementia Network.